Hey, it's Dr. Denke at Select Spine and Sports Medicine. I'm a chiropractor in Friendswood, and we are here with pro bodybuilder Randy. I've known Randy for a good while now, and he comes to me with all his problems, even his girl problems. No, but so he's having some neck pain. He came in today, and he had some problems rotating to the right, tightness, pain on the right. So we're doing some soft tissue work here on the right side to work out some of the trigger points in his neck. So with that, what I'm doing here is contacting here in the muscles that are giving him the trouble here, right at the base of the skull. And I'm holding pressure here, and then we're rotating to stretch those muscles at the same time as my pressure is applied. And you said what a minute ago about this? How does it feel?
Feels good.
Good. Really helps work out the tension there in these muscles. Helps increase that range of motion, flexibility, and soften up those muscles. Allows for the manipulation, which is coming next, to go easier and get that range of motion back. So what position do you sleep in at night?
On my stomach.
Stomach. So stomach sleepers, it's bad for your neck to sleep on your stomach. You see that a lot. A lot of people come in, wake up in the morning, can't move their neck, real stiff. Most of the time, those people are stomach sleepers. So I'm going to change directions here now. Now we're just going to go tilt to the left, really work that out here. That's a pretty tender spot right there, huh?
Yeah.
So we were talking about this before, sometimes people come in, oh, I just woke up with this, and they don't really, recall what all has led up to this. And Randy's been in a couple of car accidents, right?
Mm-hmm.
2 at least, right? And then a motorcycle accident. So we're lucky to have him. But, you have to remember each one of those little things adds up over time to create some of these chronic injuries, chronic tightness. And so it's usually not just the sleeping wrong, but it's other micro trauma or even major trauma that adds up to those kind of things. So now I'm going to get on this sternocleidomastoid, the muscle that comes from right behind the ear to going up to the clavicle and sternum, and we're going to rotate towards the right. That was really where he was feeling the most limitation, is right rotation, and he was feeling that tightness on the right. How's that feel right there?
Good. Good.
So before y'all came in to watch, we did some muscle stimulation, heat, warm these muscles up a little bit. Found out he fell asleep on that. And we've been working the upper traps, levator scapulae. We did some Graston, rock blade there, and some more of the trigger point work there on the lower trap and lower levator scapulae. And then we got into this neck here. Do a couple of good stretches here, and then we're going to get this neck moving a little bit more. I feel all right?
Mm-hmm.
Can't even talk. It feels so good. All right, let's stretch this way now. So how do you normally feel after you get adjusted?
How do I what?
How do you feel after you get adjusted?
I feel good, man. I can work out better.
That's
without
good.
pain.
That's important, right?
Yeah.
All right. So here we go. We're gonna adjust right there. Any discomfort in this position?
No.
No. Good. All right.
No.
Nice and easy here. Very good. Feel all right? All right. Now stiff right here. Okay, so here, any discomfort here?
No.
Good. That was a good one. All right, a little traction. Very good. Okay, now slide down a little bit. I'll lift that up that way. We're going to bend the knees up now. Good. Let's have you cross over. He's so dang big, can't even hardly cross his arms over. He's got a really, really tight thoracic spine here. It's hard for me to get even with double the body weight over it. Breathe in and out. Oh, that was a good one. All right, one more here. A little bit there. Okay, now flip on your stomach. We're going to get this upper thoracic, lower cervical here. I like to not ignore this area right here. We have a lot of patients who come in and they've been to other chiropractors and they'll get this area adjusted. That's pretty easy. They'll get the neck adjusted, but this lower cervical C6, 7, the last two vertebrae in the cervical spine and the upper cervical T1, T2 often gets neglected. It's a difficult area to adjust for a chiropractor, and it's also an area that gets really stiff and tight for the patient, and so it's hard to be adjusted. For me personally, it's one of my favorite adjustments to receive, and also for patients, it's typically once we get it moving, they are very happy that they got it moved because it tends to be very stiff. So what we'll do is try to get this side here. I'm going to come in right here, make a contact there, and then I'll tilt them over here, and all of my pressure is going to be right in here on this upper thoracic. So just keep that good and relaxed here. Good, one more. Good. I feel okay?
Mm-hmm.
I know I look pretty rough, but he's a big guy, so I've got to put some extra energy into him, some extra effort, and he's pretty tight. So, all right, we're going to go one more on this side. Good. Relax. Good. Got a little bit right there too. Okay, now turn on your side, going this way. I like to loosen him up all around here. Good. Bring that one right here. Good. So that's moving already. I haven't even really tried yet. All right, let's roll you this way. Good. See, the first couple, those were the easy ones. Go the other way now. The last few we have to work a little harder to get, but those are the important ones. We have actually the secretary up front, Brittany. She pops her own neck a lot. I tell her not to, but the other day she had a headache. So I said, let me work on your neck. So we came in here, we did some more of this work, and she said, I don't think you're going to be able to pop it. I can't. I don't have anything left to pop. Sure enough, I got some adjusted on either side at the very top that she'd never able to do on her own, and it gave her a pretty quick relief of the headache. Very good. Okay, now on your back. So we'll get the hips here. Just keep that nice and relaxed. Good. That was a good one. Now the same thing this side. Good. Very good. Relax. All right, come on up. Let's see the neck range of motion here. Turn this way. Now you said right was bothering you. Turn right this way. Oh, that's pretty good. Any pain with that?
Feel a lot looser.
Good. Turn that way. So even on both sides, right?
Feel a lot looser.
Pretty good. All right. Hope you all like this treatment with Randy. Go ahead and make sure you like and subscribe to the video and follow along because we've got some more coming for you. See you soon.